She's not even a real nurse. The words hung in the air like smoke, quiet enough to miss if you weren't listening, loud enough to cut if you were. Ashlyn Keller heard them. She always did. Before we begin, tell us where you are watching from, and if you want to support the channel, please subscribe and hit the like button on this video. The morning light came through the narrow windows of St. Catherine's Regional Hospital in pale stripes, cutting across the linoleum floors of the emergency department. It was 6:47 a.m. on a Monday, and the place smelled like disinfectant and burnt coffee. The kind of morning that pretended to be calm, but never was. Ash stood near the supply cart, restocking Trauma Bay 2 with gauze packs and irrigation bottles. Her hands moved in steady rhythm, no wasted motion, each item placed exactly where it needed to be. She was 29, lean and compact. Ash blonde hair pulled tight into a bun that hadn't moved in 6 hours. Pale blue eyes tracked the room even when her head didn't turn. There was a small scar along her left jaw, faint but visible if you looked close enough. No one did. She wore the same navy blue scrubs as the techs, the same ID badge clipped to her chest. Ashlyn Keller, ER Tech. Nothing more, nothing less. Across the department, near the nurses' station, Dr. Raymond Sue stood with his back to her, reviewing a chart on the computer. 52, silver hair cropped short, reading glasses perched on his nose. He'd been ER director for 3 years, long enough to believe his authority was unshakable, long enough to stop noticing the people who made his department run. Beside him, Dr. Marcus Reed leaned against the counter, arms crossed. 33, confident in the way residents are when they've survived their first year and think they know everything. His gaze drifted toward Ash, then back to Sue. That's when he said it. She's not even a real nurse. Sue didn't look up from the screen. She's a tech, does her job well enough. She acts like she's been through med school or something, Reed continued, voice low but not low enough. Always watching, always, I don't know, it's weird. Becca Torrance, the veteran ER nurse standing 2 feet away, glanced up from her medication cart. She was in her 40s, sharp-eyed and sharper-tongued when needed. She didn't say anything, not yet, but her gaze lingered on Ash for a moment longer than necessary. Ash's hands didn't pause. She finished stocking the cart, turned it toward the wall, and walked toward the break room without a word. Inside, the fluorescent lights buzzed. The room was small, just a table, a few chairs, a microwave that hadn't worked in months. Ash poured herself a cup of coffee from the pot someone had made hours ago. It was lukewarm and bitter. She drank it anyway. Her reflection stared back at her from the darkened microwave door. Tired eyes, tight jaw, the faint edge of a tattoo just visible behind her right ear if you knew to look for it. Eagle, globe, and anchor, small enough to hide, always hidden. She closed her eyes and took a breath, slow and controlled, the way she'd been taught. In, 4 counts. Hold, 4 counts. Out, 4 counts. The door swung open. Becca stepped inside, holding her own mug. She didn't say anything at first, just poured fresh coffee and leaned against the counter. You hear that? Becca asked. Scared after a moment. Ash didn't open her eyes. Hear what? Reed, being an idiot. He's a resident. It's his job. Becca smiled, but it didn't reach her eyes. You've been here 6 months. You don't talk much. You don't complain. You show up early, leave late, and you're better at IVs than half the nurses I've worked with. She paused. Where'd you work before this? Ash opened her eyes, took another sip of coffee. Around. That's not an answer. It's the one I'm giving. Becca studied her for a long moment, then nodded. Fair enough. She turned to leave, then stopped at the door. For what it's worth, you're more than competent. Don't let them make you think otherwise. The door swung shut. Ash set the mug down, stared at her hands. Steady. Always steady. That's what mattered. Her pager buzzed. She glanced down. Trauma Bay 1. Incoming. She was moving before the sound stopped. The ER exploded into controlled chaos. Monitors beeped. Radios crackled. Voices overlapped in clipped medical shorthand. A stretcher came through the automatic doors. Paramedics on either side. Compressions ongoing. Male, 62, found unresponsive at home. The lead paramedic called out. Wythe said he complained of chest pain an hour ago, then collapsed. We've been running him for 8 minutes. 2 rounds of epi. No response. Sue stepped forward, gloves already on. Get him on the monitor. Someone bag him. Reed, you're up. Reed moved to the head of the bed, took over airway management. Nurses swarmed, attaching leads, starting lines, calling out vitals that weren't there. Ash stood near the wall, hands loose at her sides, eyes tracking every movement. Sue called for another round of epinephrine. The nurse pushed it. The monitor stayed flat. Continuing compressions, Becca said, hands locked, rhythm perfect. Ash's gaze shifted to the monitor. Asystole. No shockable rhythm. Protocol said continue CPR, push medications, reassess. Protocol said a lot of things. Her eyes moved to the patient's neck. Subtle distension in the jugular vein. Then to his chest. Uneven rise on the right side during bag ventilation. She stepped forward. One step. Then stopped. Sue glanced at her. Keller, we don't need extra hands right now. She didn't move back. His right lung isn't expanding. We're bagging him fine. Check for tension pneumothorax. Reed looked up, irritation flashing across his face. We'd hear absent breath sounds. You will if you listen. Sue's jaw tightened. Keller, step back. She met his eyes, held them for 3 seconds, then stepped back. The compressions continued. Another round of epi. Still nothing. Becca paused, checked for a pulse. Nothing. Sue exhaled. All right, time of death. Wait. Becca's voice cut through. She leaned down, stethoscope against the man's chest. Her face changed. Absent breath sounds on the right. Sue froze, then moved fast. Get me a needle decompression kit, now. Ash was already holding it. He took it without looking at her, prepped the site, inserted the needle between the ribs. There was a hiss of air, sudden and sharp. The monitor beeped. Once. Twice. A rhythm. We've got him back, Becca said, voice quiet but firm. The room exhaled as one. Sue stepped back, pulled off his gloves. His gaze found Ash, still standing near the wall, expression unchanged. He didn't say, "Thank you." He didn't say anything. Reed stared at her like he'd just seen a magic trick he couldn't explain. Ash turned and walked out of the room, back to her supply cart, back to work. Becca watched her go, then looked at Shu. She knew. Lucky guess, Shu muttered. Becca didn't reply. But she didn't believe him either. If you want to see how Ashlyn Keller does the impossible when no one believes she can, make sure you subscribe to Emergency Hero Stories. Because what she does in the next few minutes will leave you speechless. The whispers started in the break room. It was 9:02 a.m. when Ash walked past the half-open door and heard her name. She didn't slow down, didn't stop, but she heard. I'm telling you, she called it before Shu even thought to check. One of the day shift nurses said, Maria maybe, or Jennifer. Ash didn't keep track of names unless they mattered in an emergency. She's a tech, another voice replied, Nail. One of the newer residents. How does a tech spot a tension nouveau faster than an ER director? Maybe she got lucky. Twice? What do you mean, twice? Last week, that kid with the head injury. Everyone said concussion protocol, but she kept watching him. Told Becca something was off. Turned out he had a slow bleed. Nobody else saw it coming. Silence. Then, who is she? Ash turned the corner, headed toward the med supply room. The question followed her like a shadow. She didn't have an answer she was willing to give. By 9:15, the ER had quieted into the lull that came between waits. Shu stood at the nurse's station, finishing charts. Reed hovered nearby, pretending to review lads but really just scrolling his phone. Becca approached with a tablet. We've got a direct admit coming down from clinic. 38-year-old male, right lower quadrant pain, fever, elevated white count, looks like appendicitis. Shu nodded without looking up. Schedule him for surgery, call the team. They want him prepped in 30 minutes. OR's backed up, but they've got a slot at 10. Fine, who's available to take him? Becca glanced at the board. Everyone's tied up except Reed and Keller. Shu finally looked up. Reed, go prep the patient. Keller can assist. Reed's expression flickered, just for a second. Something between annoyance and dismissal. I don't really need. Then it'll go faster. Shu said flatly, move. Reed pushed off the counter and walked toward Trauma Bay 3, where the patient had just been wheeled in. Ash was already there, pulling gloves from the box on the wall. The patient lay on the stretcher, mid-30s, face pale and sweating. His name was Colin Marsh, according to the chart. He worked at the mill. His wife sat in the waiting room, chewing her nails down to nothing. Reed stepped up to the bedside, flicked through the chart. Mr. Marsh, I'm Dr. Reed. We're going to get you comfortable and ready for surgery. Shouldn't take long. Colin nodded, jaw tight. It hurts worse than it did this morning. That's normal with appendicitis. We'll get some pain meds on board. Ash moved to the IV pole, checked the line already placed by the clinic nurse. Patent, good flow. She scanned the monitor. Heart rate 110, blood pressure 128/82, respiratory rate 20, oxygen saturation 97%. Reed ordered morphine. The nurse pushed it. Colin's face softened, but only slightly. Ash's gaze dropped to his abdomen, distended, guarding on the right side, but something else, a faint discoloration near the flank, just visible above the waistband of his hospital gown. She stepped closer. When did the bruising start? Reed glanced over. What bruising? She pulled the gown up slightly, just enough to reveal the skin. A pale purple shadow spreading across the right flank and lower back. Colin blinked, groggy from the morphine. I don't know. Didn't notice it. Reed frowned. Could be from the pain. People bruise easy sometimes. Ash's eyes stayed on the discoloration. Her fingers hovered over it, not touching, just weeding the shape. Gray Turner's sign. Reed's frown deepened. That's for pancreatitis. This is appendicitis. Or retroperitoneal hemorrhage. His pressures are stable. For now. Reed straightened, irritation flashing across his face. Look, I appreciate the input, but this is a straightforward case. Appendix comes out. He goes home in 2 days. Ash met his eyes. Her voice didn't rise, didn't push, just held. Check his hemoglobin. We already have labs. Check it again. Reed stared at her, jaw working. Then he turned to the nurse. Run a repeat CBC. The nurse hesitated, glanced at Ash, then nodded and left. 5 minutes later, she returned. Her face had changed. Hemoglobin's dropped. Was 13 this morning, now it's 10.2. Reed's expression froze. He looked at the monitor again. Blood pressure still stable, but the heart rate had climbed to 118. Ash's voice was quiet. He's bleeding somewhere. Reed grabbed the bedside ultrasound, powered it on, placed the probe on Colin's abdomen. The screen flickered to life. He moved it slowly, scanning, then stopped. Fluid. Free fluid in the abdomen. Dark. Not a little. A lot. Jesus, Reed whispered. Ash was already moving. Page surgery. Now. And call for 2 units of O negative. Reed didn't argue this time. He grabbed his phone, hands shaking slightly as he dialed. Becca appeared in the doorway. What's going on? Ruptured something, Reed said, voice tight. Not the appendix. Maybe the iliac artery. I don't know. He's bleeding into his belly. Becca's eyes went wide. She turned to Ash. What do you need? Get him to OR. Fast. He's compensating now. But he won't be in 10 minutes. Becca moved. The room exploded into action. Nurses swarmed. The stretcher was already rolling before the surgeon even answered the page. Colin looked up at Ash, fear breaking through the morphine haze. Am I going to die? She leaned down, just slightly, her voice calm and even. No, but we need to move fast. Stay with us. He nodded, barely. The stretcher disappeared through the double doors. Reed stood in the empty trauma bay, staring at the ultrasound screen still frozen on the image of blood pooling where it shouldn't be. Becca walked up beside him. If she hadn't seen that bruising, I know. He would have gone to OR for an appendectomy. They wouldn't have been ready for a vascular bleed. I know. Becca looked toward the doors where Ash had gone. She's not just a tech. Reed didn't answer. He didn't have to. Across the ER, near the supply room, Ash pulled off her gloves and tossed them in the trash. Her hands were steady. They always were. But inside, behind the comm, behind the control. Something old and familiar. ER stirred. Muscle memory, pattern recognition, the weight of training that never really left. She closed her eyes, took a breath. In, 4 counts. Hold, 4 counts. Out, 4 counts. Then she went back to work. By 11 a.m., the ER had filled again. Mondays always did this. The weekend injuries that people ignored until they couldn't anymore came flooding in. Sprained ankles, fevers, chest pains that were probably nothing, but might be everything. Ash moved between rooms like water, restocking, cleaning, assisting. No wasted motion, no hesitation. She was halfway through changing the linen in Trauma Bay 2 when the code alarm went off. The sound was sharp and relentless, cutting through every conversation, every thought. Code blue, Trauma Bay 4. Code blue, Trauma Bay 4. Ash dropped the sheets and ran. She hit the doorway 3 seconds before anyone else. The patient on the bed was a woman, mid-50s, unconscious. Gray hair matted with sweat, skin the color of old paper. The monitor screamed. Ventricular fibrillation. The worst kind of chaos pretending to be a rhythm. Becca was already at the bedside, ripping open the crash cart. She just came in for chest pain. We were getting an EKG and she dropped. Ash didn't wait for orders. She climbed onto the bed, locked her hands, and started compressions. Hard and fast. The woman's sternum flexed under her palms with each push. 30 compressions, rhythm, muscle memory. Reed burst through the door, followed by 2 more nurses. What do we have? V-fib, Becca called out. Just started. Charge the D-fib, 200 joules. One of the nurses pressed the pads to the woman's chest. The machine whined as it charged. Clear, Reed said. Ash pulled back. The woman's body jolted. The monitor hiccuped, then screamed again. Still, V-fib. Ash resumed compressions immediately. No pause, no breath wasted. Charge again. Same dose. Push 1 milligram of epi. The nurse pushed the medication. The D-fib charged. Another shock. Another jolt. The monitor stuttered, then flatlined into asystole. Worse. Much worse. Continue compressions, Reed said, but his voice had lost some of its edge. Push another epi. Ash kept going. Her shoulders burned, her hands ached. Didn't matter. 30 compressions, 2 breaths from the bag valve mask Becca held. 30 more compressions, 2 minutes passed, then 3. Chu appeared in the doorway, eyes scanning the room. Talk to me. 53-year-old female, V-fib arrest, now asystole, Reed said. 3 shocks, 2 rounds of epi. No response. Chu stepped closer, watched the monitor. His face didn't change, but Ash saw it. The decision forming behind his eyes. How long has she been down? 6 minutes, Becca said. Chu's jaw tightened. 1 more round, then we call it. Ash's hands didn't stop, didn't slow, but her mind was already somewhere else. 6 minutes. Downtime before they even started. That meant 8, maybe 9 total. Brain damage started at 4. By 9, most people didn't come back. And if they did, they weren't the same. But most wasn't all. She looked at the monitor again. Asystole. Flat. Nothing to shock. Nothing to restart. Except, her eyes dropped to the woman's neck. Jugular veins. Flat. Empty. That wasn't right. In a code, veins distended from the backup of blood. Unless there wasn't enough blood to back up. He's hypovolemic, Ash said, voice cutting through the noise. Reed glanced at her, confusion flickering across his face. What? She's dry. Look at her neck veins. She's not circulating enough volume. We've been running fluids. Not fast enough. And if she's bleeding somewhere internally, it doesn't matter what we push. We need to find the source. Jesus stepped forward. Keller, this is a cardiac arrest, not a trauma. Ash didn't look at him. Her eyes stayed on the patient. Ruptured aortic aneurysm. She came in with chest pain, not because of her heart, because something tore. That's a hell of a leap. Check her belly. Jesus stared at her for 3 long seconds. Then he moved. He pulled up the woman's gown, placed his hands on her abdomen. Pressed gently. The abdomen was distended, firm, not soft like it should be. His face changed. Get me an ultrasound, now. Becca grabbed the portable unit, wheeled it over. Jesus squirted gel onto the woman's abdomen. Placed the probe, and moved it slowly across her belly. The screen lit up, and there it was. A massive dark pocket of fluid surrounding the aorta. Blood, liters of it. Jesus Christ, Reed whispered. She's bleeding out, Jesus said, voice tight. Get vascular surgery on the phone, and OR. We need to crack her chest. Ash kept compressions going, rhythm perfect, even as the room exploded around her. She won't make it to OR, Ash said. Jesus looked at her. What are you suggesting? Resuscitative thoracotomy. Here, now. The room went silent, except for the monitor's scream and the sound of Ash's compressions. Reed's eyes went wide. That's a last-ditch trauma procedure. We're not a trauma center. She's already dead, Ash said, voice calm, factual. This is her only chance. Jesus' jaw worked. He looked at the monitor, at the woman's gray face, at Ash, still doing compressions like a machine that refused to stop. You've done one before, he said. Not a question. Ash met his eyes. Yes. Where? Does it matter? Another second passed. Then Jesus turned to Becca. "Get me a thoracotomy tray. Scalpel, rib spreaders, clamps. Move." Becca ran. Ash stepped back, hands finally still. Jesus snapped on fresh gloves, grabbed the betadine, and poured it across the woman's chest. No time for sterile draping. No time for anything but the cut. He made the incision. Left side, 5th intercostal space, one long slice from sternum to spine. Blood welled up immediately. He grabbed the rib spreaders, inserted them, and cranked. The ribs parted with a sickening crack. The heart was visible now, flaccid, still, no movement. Jesus placed his hand around it and squeezed. Manual compressions, direct, brutal, effective. "Cross-clamp the aorta," he said. Ash was already holding the clamp. She passed it over. Jesus reached into the chest cavity, found the descending aorta, and clamped it shut, stopping the bleed. Redirecting what little blood was left to the brain and heart, he kept squeezing. Once, twice, 3 times. The monitor beeped. Once, then again, a rhythm, weak but there. "We've got her back," Becca said, voice barely above a whisper. Jesus kept squeezing, mechanical now, until the rhythm steadied. Then he looked up, face pale, hands covered in blood. "Get her to OR, now. Tell them she's open and clamped. They need to be ready the second she hits the table." The stretcher was already moving. The room emptied in seconds, leaving only Shu, Ash, and the blood-soaked sheets. Shu pulled off his gloves, tossed them in the trash. He looked at Ash, really looked. "Where did you learn to do that?" Ash's expression didn't change. "I can take the next one too." She turned and walked out. Shu stood there, staring after her, questions piling up faster than he could process. Becca stepped up beside him, wiping her hands. She knew. Again. Shu didn't answer. He just watched the empty doorway where Ash had disappeared. The cafeteria coffee tasted like burnt plastic, but Ash drank it anyway. She sat alone at a corner table, still in her blood-stained scrubs, staring at nothing in particular. Her hands rested flat on the table, steady. They were always steady. Across the room, Reed sat with 2 other residents, voices low but animated. Every few seconds, one of them glanced her way. She didn't look back. Her pager buzzed. She glanced down, expecting another routine call. Instead, the screen flashed red. Mass casualty alert. All available personnel, report to ER. ETA 4 minutes. She was on her feet before the announcement finished crackling over the PL system. The ER transformed in seconds. Nurses cleared beds, techs wheeled in extra crash carts, and doctors appeared from every corner of the hospital. The air thickened with tension. That specific kind of electricity that came before something catastrophic arrived. Shu stood at the center of the chaos, radio in hand, listening to the dispatch report. His face had gone pale. Ash approached, said nothing, just waited. Shu lowered the radio. Logging truck lost control on Highway 58, went through the guardrail, and hit a school bus, head-on. He paused. 15 kids on board. Drivers dead. Truck drivers critical. Multiple pediatric traumas inbound. The words hung in the air like a physical weight. "How many minutes out?" Becca asked, appearing beside them. 3 now, maybe less. Life flights bringing the worst ones straight to Portland, but we're getting everyone who can't wait. Reed pushed through the crowd. "How many are we taking?" 6 confirmed, maybe more. The doors burst open. Paramedics flooded in, radios crackling, voices overlapping in controlled panic. Female, age 8, GCS 12, head trauma. Possible internal bleeding. Male, age 6, open femur fracture, pressures dropping. Female, age 10, chest trauma, decreased breath sounds on the left. The room exploded. Every available bed filled within 90 seconds. Monitors screamed. Nurses shouted med orders. Shu moved between rooms like a general on a battlefield, barking orders, directing traffic. Ash found herself in Trauma Bay 2 with a boy no older than 7. His name was Ethan. Blonde hair, matted with blood. His left arm bent at an angle that made her stomach twist, but she didn't let it show on her face. A nurse worked on getting IV access. Another checked vitals. Ash cut away his shirt, exposing his chest and abdomen, bruising across the ribs. Possible pulmonary contusion. "Ethan, can you hear me?" she asked, leaning close. The boy's eyes fluttered open, glassy and unfocused. "Mom? She's coming, but I need you to stay awake for me, okay? He nodded weakly. The monitor beeped. Heart rate 140, blood pressure 90/60, low but not critical yet. Oxygen saturation, 92%. Ash's hands moved automatically, checking pupils, palpating the abdomen, soft, no rigidity. The arm was the priority. She could see bone through the torn skin. Get me an ortho consult and 2 units of O-neg on standby, she called out. The nurse nodded and grabbed the phone. Ash splinted the arm quickly, efficiently, the way she'd done 100 times before, in places that didn't have the luxury of waiting for specialists. Ethan whimpered. She kept her voice calm. You're doing great. Just a little longer. Behind her, she heard Hu's voice rising in the hallway. Where the hell is the trauma surgeon? Stuck in surgery. Won't be available for another 30 minutes. We don't have 30 minutes. Ash finished securing the splint and stepped into the hallway. The chaos was thicker now. More stretchers, more blood, more voices calling for help that wasn't coming fast enough. And then she saw him. Trauma Bay 5. A man on a stretcher, mid-40s, covered in blood and dirt. Paramedics on either side. One of them was Jake Torres, a paramedic she'd seen around but never worked with closely. Former Army medic, according to the hospital gossip. He had the look, the posture, the way he moved with purpose even when everything was falling apart. Jake's voice cut through the noise. Male, 47, logging truck driver, crush injuries to the chest and abdomen, flail chest. Possible ruptured spleen. He's been coding on and off for the last 10 minutes. We've shocked him twice. Who appeared, took one look at the patient, and his face changed. Get him on the monitor. Someone get me a chest tube kit. Ash stepped closer. The man's chest moved wrong. Paradoxical breathing. Ribs broken in multiple places. Each breath looked like it might be his last. Jake glanced at her, then did a double take. His eyes narrowed slightly, scanning her face, her posture. The way her hands hovered near her sides, ready. He stepped closer, lowered his voice so only she could hear. You're not just a tech. It wasn't a question. Ash didn't answer. She just held his gaze for a fraction of a second, then turned back to the patient. Who inserted the chest tube? Blood poured out, dark and thick. Too much blood. He's bleeding into his chest, Who said. We need to get him to OR now. OR's full, Becca said from the doorway. They said 20 minutes minimum. He doesn't have 20 minutes. The monitor alarmed. The man's blood pressure dropped. 70/40. Then 60/30. He's crashing, Reed said, stepping forward. Ash's eyes tracked every detail. The distended abdomen, the mottled skin, the way his breathing had gone shallow and rapid. She knew what was coming next. She'd seen it before, too many times. Who looked at the monitor, then at the patient, then at the clock on the wall. His face was the face of someone doing math they didn't want to finish. Prep for a thoracotomy, he said quietly. Here? Reed's voice cracked slightly. We don't have a choice. Ash stepped forward. I can assist. Who looked at her, something unreadable in his eyes. You've done 2 impossible things today already. You sure you want to go for 3? She didn't hesitate. Yes. Jake was still watching her, and now his expression had shifted. Recognition, slowly dawning. Piece by piece. He stepped closer again, voice low. Where'd you soz? Erv? Ash's hands didn't move, her face didn't change, but something in her eyes flickered. Later, she said. Jake nodded once. Then he moved to help prep the patient. Before you see what happens next, we need to ask, have you subscribed yet? Because what Ashlyn does in the next few minutes will redefine everything you thought you knew about her. Hit that subscribe button and drop a comment telling us where you're watching from. You won't want to miss this. The thoracotomy took 11 minutes. Sue made the incision, Ash held retraction, and together they cross-clamped the descending aorta to buy the man time he didn't have. By the time they got him stable enough to move, his blood pressure had climbed back to something resembling survivable. The OR team took him 60 seconds later, wheeling him out at a near run. The trauma bay went silent. Just the drip of saline from an IV pole and the hum of monitors no longer attached to anyone. Sue stripped off his gloves, stared at his hands. They were shaking. Just slightly, but enough. Ash's weren't. He noticed. Come with me, he said, voice flat, drained. She followed him through the chaos of the ER, past the pediatric bays, where nurses were still stabilizing the last of the bus crash victims, past the waiting room, overflowing with parents and teachers. Down a narrow hallway to his office. He opened the door, gestured inside. She stepped in. He closed the door behind them. The office was small. Desk covered in paperwork. Shelves lined with medical texts. A photo on the wall from his days at a Level 1 trauma center in Portland. Younger, confident. Before the burnout brought him here. He leaned against the desk, arms crossed, and just looked at her. 6 months, he said finally. You've been here 6 months. Quiet. Kept your head down. Did your job. Never asked for anything. Never made a scene. He paused. But today you diagnosed a tension pneumothorax before I did. You caught a retroperitoneal bleed that would have killed a man on the OR table. You called a ruptured AAA in a coding patient and assisted in a resuscitative thoracotomy, like you'd done it 100 times. His voice hardened. And just now, you held retraction on an open chest in a mass casualty situation without flinching. Ash said nothing. Her face was still, calm, the same face she wore during compressions, during codes, during everything. So I'm going to ask you once, Sue continued, and I want the truth. Where did you train? She met his eyes. Does it matter? Yes, it matters. Because if you're practicing medicine without a license, I need to know. And if you're not, then I need to know why the hell you're working as a tech instead of wearing a white coat. Her jaw tightened, just barely. I'm not practicing medicine. I'm assisting. That's within scope. That's a politician's answer. It's the only one I have. Sue exhaled through his nose, frustration bleeding into his voice. I watched you work today, Keller. You don't move like a tech. You don't think like a tech. You move like someone who's seen more trauma than most ER docs will see in a lifetime. He leaned forward. So I'm going to ask again. Where did you serve? The word hung in the air. Serve. Ash's expression didn't change, but something behind her eyes shifted. A wall going up, brick by brick. I didn't. The door burst open. Becca stood in the doorway, face flushed, breathing hard. We've got another one. Just came in. Marine. Civilian clothes but still has his dog tags on. Motorcycle accident on Route 38. Massive chest trauma. He's barely holding on. Husu turned. Where's Reed? Still with the kids. You're the only attending available. He looked back at Ash, jaw tight. We're not done here. I know. They moved. Trauma Bay 1. The Marine was already on the bed, shirt cut away. Chest, a mess of bruises and lacerations. Mid-30s, broad shoulders. Tattoos down both arms, a medic cross on his right forearm. Dog tag still around his neck, blood-stained and twisted. Jake Torres was there, hands already moving, getting IV access. He looked up when Ash walked in, and his eyes locked onto hers. He knew. She could see it. Gunnery Sergeant Daniel Cross, Jake said, voice steady but edged with something raw. 34, just back stateside 3 months ago. Lost control of his bike on a turn. No helmet. Chest hit the guardrail full force. Flail chest, possible cardiac contusion, lung collapse on the right. He's been in and out of consciousness since we found him. Husu stepped up to the bedside. Sergeant Cross, can you hear me? The Marine's eyes fluttered open, unfocused, glassy, but aware. Yeah, he rasped. I hear you. We're going to take care of you. Just stay with us. Cross's gaze drifted across the room, scanning faces, the ceiling, the monitors. Then it landed on Ash. He stared. She stared back, his breathing hitched. Doc. Ash froze. Husu glanced at her, then back at the patient. She's not a doctor. She's a tech. Cross's head shook slowly, weakly. No, that's Doc Keller. His voice cracked, pain and recognition mixing into something desperate. Helmand, FOB Delaram, 2015. He coughed, blood speckling his lips. You pulled me out of a ditch after an IED lit us up. Kept me breathing until the bird came. The room went still. Every eye turned to Ash. She didn't move, didn't speak. Her face was a mask, but her hands, still at her sides, curled into fists so tight, her knuckles went white. Jake stepped back slightly, realization washing over his face. You're a corpsman. Not a question. A statement. Husu's voice was low, controlled. Keller. She didn't look at him. Her eyes stayed on Cross, on the man who was dying in front of her. The man who remembered her when she'd spent 4 years trying to forget. Ash, Cross whispered, using her first name like a lifeline. Don't let me die here. Not like this. Her jaw trembled, just once. Then it stopped. She looked at Husu. We need to intubate him now. His lungs collapsing. If we don't get a tube in and decompress that chest, he's got maybe 3 minutes. Husu stared at her. You're not authorized. I know, but he's right. I'm Doc Keller, hospital corpsman. 3rd Battalion, 5th Marines. 2 tours, Helmand Province and Anbar. I've done this more times than I can count. Her voice didn't waver, didn't break. So you can waste time being angry, or you can let me help save his life. The silence stretched. Then Husu grabbed the intubation kit. Do it. Ash moved. Ash's hands didn't shake. Not once. She positioned herself at the head of the bed, tilted Cross's head back, and opened his mouth. His airway was clear. But his breathing was shallow, rapid, desperate. Each breath sounded wet. Blood in the lungs. Suction, she said. Becca handed it over. Ash cleared his airway in 2 quick passes, then set it aside. Laryngoscope. The curved metal blade slid into Cross's mouth. She visualized the vocal cords, pale and slick with blood. The opening was there. Small, but there. Tube, 7.5. Sue handed it to her without a word. She threaded it through in one smooth motion, past the cords, into the trachea. No hesitation. No second guessing. Inflate the cuff. Becca did. Ash pulled the laryngoscope out, attached the bag valve mask, and squeezed. Cross's chest rose, both sides, equal expansion. He's in, she said. Sue checked with his stethoscope. Breath sounds bilateral. He nodded once, something like respect flickering across his face. But they weren't done. The monitor shrieked. Heart rate climbing. 140, 150. Blood pressure dropping. 80/50. Then 70/40. He's crashing, Reed said from the doorway, eyes wide. Ash looked at the monitor, then at Cross's chest. The right side wasn't moving the way it should. Tension pneumothorax, again, but worse this time. I need a 14-gauge needle and a chest tube kit, she said, voice calm, mechanical. Sue didn't question her. He just moved, grabbed the supplies, handed them over. Ash prepped the site. Right side, 2nd intercostal space, mid-clavicular line. She didn't wait for permission, didn't wait for anything. Just drove the needle in. The hiss of air was immediate. High pressure, violent. Cross's oxygen saturation climbed. 88%, 91%, 94%. But the blood pressure kept falling. He's bleeding somewhere, Jake said, hands already moving to start another IV line. We're pouring fluids in and it's not staying. Ash's eyes scanned Cross's body. The bruising across his chest, the distension in his abdomen, the mottled skin creeping up from his flanks. She'd seen this before, too many times. He's got internal bleeding, probably the spleen or liver, maybe both. Sue grabbed the ultrasound, moved a probe across Cross's abdomen. The screen lit up with dark pockets of free fluid. Blood, liters of it. He needs surgery, now. OR still full, Becca said, voice tight. They said 10 more minutes. He doesn't have 10 minutes. The monitor alarm intensified. Blood pressure 60/30, heart rate 170. Cross's eyes opened, just slightly. His lips moved, but no sound came out. Ash leaned closer. I'm here, Cross. Stay with me. His hand twitched, reaching. She took it. His grip was weak, but it was there. Don't let me die, he whispered, the words barely audible over the alarms. Her jaw tightened. I won't. She looked at Sue. We need to open him up, here. Sue stared at her. That's the 3rd open chest today, in an ER. We're not a trauma center, Keller. I know, but he's a Marine. And I'm a corpsman. And we don't leave our people behind. The words hit like a physical blow. The room went silent except for the alarms. Sue looked at Cross, at the monitor, at the clock, then back at Ash. Do it, he said. Ash let go of Cross's hand, snapped on fresh gloves. Becca handed her the scalpel. The betadine was already poured. She made the incision, left side, 5th intercostal space, one long, decisive cut. Blood welled up immediately, but her hands didn't falter. She grabbed the rib spreaders. Durs positioned them and cranked. The ribs gave with a crack that echoed in the small room. The heart was visible, still beating but weak, fluttering. Clamp the aorta, Who said, stepping beside her. She reached in, found the descending aorta, slick and pulsing under her fingers. She placed the clamp and locked it down. Blood flow redirected, brain and heart prioritized. Cross's blood pressure stabilized. Just barely, 70/40, but it wasn't enough. He's still losing blood from the abdomen, Ash said. We need to pack it. Who said didn't hesitate. He grabbed lap pads, handed them to her. She reached into the chest cavity, past the heart, and packed the bleeding vessels as best she could. It was brutal, primitive, but it was working. The monitor beeped steadily now. Rhythm holding, pressure holding. Jake stepped forward, staring at Ash like he was seeing her for the first time. How many times have you done this? She didn't look up. Enough. In combat? In a tent. In a Humvee. On the side of a road with mortars coming in. Her voice was flat, factual, wherever it needed to be done. Who was silent, hands still assisting, but his eyes were on her now. Really on her. Why didn't you tell anyone? He asked quietly. She didn't answer immediately. Her hands kept moving, adjusting the packing, checking for new bleeding. Finally, she spoke. Because the last time I did this, the Marine died anyway, and they blamed me for it. The room went still. Al-Qaim, 2017, she continued, voice steady but hollow. Ambushed convoy. 3 casualties. I did everything right, everything by the book. But the bird took too long. And when he died, they said I missed something. Said I didn't do enough. She paused. Medical review cleared me 6 months later. But by then, it didn't matter. I'd already left. Cross's hand moved again, fingers twitching. She glanced down. His eyes were open. Just barely, looking at her. You saved me, he whispered. Not yet, she said, but I will. The doors burst open. The OR team arrived, ready to take over. Ash stepped back, stripped off her gloves. Her hands were covered in blood. Her scrubs were soaked, but her face was calm. Who stood beside her as they wheeled Cross out? He didn't say anything for a long time. Finally, he spoke. You're not just a tech. No, she said. I'm not. Why are you here? She looked at him, and for the first time, her mask cracked, just slightly. Because I didn't know where else to go. Who nodded slowly. Then he held out his hand. She stared at it for a moment, then shook it. Welcome to the team, Doc Keller, he said. 6 days passed before Ash heard anything official. She kept working, kept showing up, kept doing her job. The ER staff treated her differently now. Not with pity, not with suspicion, with something closer to quiet respect. Nurses asked her opinion on patients. Residents stopped dismissing her observations. Even Reed had started calling her by her first name. But who hadn't said anything? Not since that moment in the trauma bay when he'd called her Doc Keller. She told herself it didn't matter. Told herself she was fine being a tech. Told herself she didn't need validation. She was lying. On the 6th day, Becca found her in the supply room, restocking suture kits. Who wants to see you? Becca said. His office. Now. Ash sat down. When the box she was holding, did he say why? No, but the hospital administrator is with him. Her stomach tightened. She nodded, wiped her hands on her scrubs, and walked. The hallway felt longer than usual. Her boots squeaked on the linoleum. Somewhere behind her, a monitor beeped. A phone rang. Life continued, indifferent. She knocked on Sue's office door. Come in, his voice called. She opened the door. Sue sat behind his desk. Beside him stood a woman in her 50s, gray suit, sharp eyes. Margaret Foster, hospital administrator. Ash had seen her from a distance, but never spoken to her. Sit, Sue said, gesturing to the chair across from him. Ash sat. Her hands rested on her thighs. Steady. Margaret leaned against the desk, arms crossed, studying her. Ashlyn Keller, hospital corpsman, 3rd Battalion, 5th Marines, 2 combat tours, honorable discharge in 2018 following an incident in Al-Qaim, Iraq, where you were initially blamed for the death of a Marine patient during an ambushed medevac. She paused. You were later cleared by a medical review board, which concluded you performed all procedures correctly, and that the delay in air transport was the primary cause of death. Ash said nothing, just listened. Margaret continued. Since then, you've worked as an ER tech here for 6 months. Kept your head down, didn't mention your background, didn't ask for anything. She tilted her head. Until last Monday, when you assisted in 3 resuscitative thoracotomies in one day and saved 4 lives that by all rights should have been lost. The room was silent. "Why didn't you tell us?" Margaret asked, voice not unkind, just curious. Ash's jaw tightened. She took a breath. "Because I didn't think it mattered. I'm not a nurse. I'm not a PA. I'm not a doctor. I'm a corpsman. And outside the military, that doesn't mean much. It means you have more trauma experience than most physicians will ever see," Sue said quietly. "It also means I was blamed for something I couldn't control," Ash replied, voice steady but edged with something harder. "And I didn't want to go through that again." Margaret nodded slowly. "I understand. But here's the situation. Over the last 6 days, I've received calls from the families of 3 patients you helped save. I've had nurses and doctors in this ER submit written statements vouching for your competence. I've had a Marine gunnery sergeant tell me, in no uncertain terms, that you are the reason he's still alive." She paused. "And I've reviewed your military medical records, which are frankly extraordinary." Ash's heart rate picked up, just slightly. She didn't let it show. "So here's what I'm offering," Margaret said. "We're creating a new position. Emergency medical specialist. It's a hybrid role, somewhere between a tech and a physician assistant. You'd work directly with our ER doctors, handle trauma cases, perform advanced procedures under supervision. We'd also help train our staff in combat casualty care techniques." She leaned forward. "It's not a nursing degree. It's not a PA certification. But it's a recognition of what you can do, and what you've already proven you can do." Ash stared at her. "Why?" "Because this hospital needs people like you," Sue said, "and because you've earned it." The words hit harder than she expected. She looked down at her hands, still steady. Always. Always steady. But inside, something old and buried started to crack. "I need to think about it," she said quietly. Margaret nodded. "Take your time, but not too long. We've already had 2 other hospitals reach out asking about you. Word travels fast." Ash looked up. "What?" "Gunnery Sergeant Cross posted about you on a military veterans page. Called you the best combat medic he'd ever worked with. Said you saved his life twice, once in Helmand and once here." Margaret smiled faintly. "It's been shared about 4,000 times." Ash closed her eyes, took a breath. "I'll think about it," she said again. "Good," Margaret said. She stood, extended her hand. Ash shook it. Margaret left. The door clicked shut. Sue leaned back in his chair, studying her. "You don't think you deserve this." It wasn't a question. Ash didn't answer. "You think that Marine in Al-Qaim died because you weren't good enough," Sue continued, "and no amount of official clearance will change that." Her jaw tightened. "He died because I couldn't save him. He died because he was shot multiple times in an ambush, and the helicopter took 30 minutes to arrive. You kept him alive for 28 of those minutes. That's not failure, Keller. That's a miracle." She looked away. "It didn't feel like one. It never does." Sue leaned forward. "I left Portland because I lost a patient on my table. Routine surgery. Everything went right. And she still died. I couldn't shake it. So I came here, thinking I'd find something quieter. Something easier." He paused. "But you don't get to choose when people need you. You only get to choose whether you show up." Ash met his eyes. "You showed up," he said, "and you saved lives. So stop punishing yourself for the one you couldn't save, and start accepting credit for the ones you did." Her throat tightened. She nodded once, then stood. "I'll let you know." She walked out. That night, Ash sat in her apartment, staring at her phone. The post from Cross was still up. She'd read it 3 times already. "Doc Keller saved my life today. Some of you might remember her from Helmand. She pulled me out of a ditch after an IED in 2015. Thought I'd never see her again. Then I crashed my bike last week, and there she was, in a hospital in Oregon, still saving lives. If you ever meet her, thank her. She doesn't think she's a hero, but she is." The comments were filled with other Marines, other sailors, other veterans who remembered her, who'd been treated by her, who were alive because of her. She set the phone down, closed her eyes, and for the first time in a long time, let herself believe it. 2 days later, she walked into Sue's office. "I'll take the position," she said, "on one condition. Name it. I want to start a program. Teach ER staff how to handle mass casualties. Combat trauma techniques. Stuff they don't learn in school. Sue smiled. Done. She nodded. Then, quietly, thank you. Don't thank me, just keep doing what you do. She walked out, and for the first time in years, felt like she was exactly where she was supposed to be. 18 months later, the ER looked different. Not in structure, not in layout, but in the way people moved through it. Faster, sharper, more confident. Ash stood in the center of Trauma Bay 1, leading a training session. 6 nurses, 3 residents, 2 paramedics. All of them. Them focused. All of them listening. Tension pneumothorax doesn't wait for confirmation, she said, voice calm, clear. You see distended neck veins, absent breath sounds, hypotension. You act. Needle decompression first, chest tube second. You don't wait for imaging. You don't wait for an attending. You save the life first and justify it later. One of the nurses, young, maybe 25, raised her hand. What if we're wrong? Then you apologize and document it. But if you're right and you don't act, that patient dies, and you don't get a second chance. The nurse nodded, something shifting in her expression. Understanding, confidence. Ash moved to the next scenario. A mannequin on the bed, fake blood pooling around a simulated chest wound. Resuscitative thoracotomy, last ditch. Only when the patient is dead or about to be. You crack the chest, you clamp the aorta, you buy time. She looked at each of them. It's brutal, it's invasive, and it works. She demonstrated the incision, the placement of the rib spreaders, the technique for clamping the aorta. Her hands moved with the same steady precision they always had. When she finished, the room was silent. Then one of the residents spoke. How many times have you done this for real? Ash paused. Enough to know it saves lives when nothing else will. The session ended 20 minutes later. The group filtered out, talking among themselves, energized. Becca appeared in the doorway, arms crossed, smiling. You're good at this. Ash pulled off her gloves, tossed them in the trash. It's just teaching. It's more than that. You're giving them confidence they didn't have before. That matters. Ash shrugged, but something in her expression softened. I'm just passing on what I learned. From who? People who didn't give up on me when they should have. Becca studied her for a moment, then nodded. You hear about the offer? Ash looked up. What offer? Margaret didn't tell you? The VA Medical Center in Portland. They want you to run a new program, integrating combat medics and corpsmen into civilian trauma care. National pilot program. Big funding, bigger reach. Ash's stomach tightened. She didn't mention it. She will. They've been calling all week. Ash said nothing, just stared at the empty trauma bay, the training mannequin still on the bed, the fake blood still pooling. You going to take it? Becca asked. I don't know. Why not? Because I just got here. Just figured out where I fit. Becca smiled. You fit everywhere, Ash. You just didn't know it yet. She left. The room went quiet. Ash stood there, hands resting on the edge of the bed, thinking. That evening, she sat in Margaret's office again. Same chair, same desk, different conversation. They want you, Margaret said simply. And honestly, I can't blame them. What you've built here in 18 months is remarkable. Our trauma survival rate is up 23%. Staff confidence is higher. We've had 0 misdiagnoses on major traumas since you started training. She paused. You've changed this place. Ash looked down. I just did my job. You did more than that. And now you have a chance to do it on a bigger scale. Train medics and corpsmen across the country. Integrate military trauma care into civilian ERs. Save more lives than you ever could in one hospital. And if I say no? Margaret smiled. Then you stay here. Keep teaching, keep saving lives. Either way, you've already proven what you needed to prove. What's that? That you're not defined by the one you couldn't save. You're defined by the hundreds you did. Ash's throat tightened. She nodded slowly. I'll think about it. I know you will. Margaret leaned back. But Ash, for what it's worth, I think you should go. Not because I want to lose you, but because the world needs what you have to offer. Ash left the office and walked through the ER. It was quiet tonight. A few patients in the waiting room. A couple of nurses charting. The low hum of monitors and machines. She passed Trauma Bay 1. The lights were off, but she could still see the outline of the bed, the crash cart in the corner, the defibrillator on the wall. She thought about Cross, alive and walking now, back with his unit. She thought about the logging truck driver, recovered and home with his family. She thought about the woman with the ruptured aneurysm, the man with the tension pneumothorax, the boy with the broken arm. She thought about all the ones she'd saved, and for the first time, she let herself stop thinking about the one she hadn't. 3 weeks later, Ash stood in the parking lot of St. Catherine's, loading the last box into her truck. Becca stood beside her, arms crossed, trying not to cry. "You better stay in touch," Becca said. "I will. And you better come back and visit." "I will." Becca pulled her into a hug. Ash stiffened for just a second, then hugged her back. "You saved a lot of lives here," Becca whispered. "Don't forget that." "I won't." Hughes walked up, hands in his pockets. "Portland's lucky to have you." Ash nodded. "Thank you, for everything. Don't thank me. You earned it." She climbed into the truck, started the engine. As she pulled out of the parking lot, she glanced in the rearview mirror. Becca and Hughes stood there, watching her go. She didn't look back again. 6 months after that, the program launched. Corpsmen and combat medics integrated into civilian trauma centers across 12 states. Ash traveled constantly, teaching, training, consulting. She got a call one night from a hospital in Arizona. A young corpsman, just out of the Navy, struggling to find his place. They asked if she could talk to him. She did. She told him what no one had told her, that the skills mattered, that the experience mattered, that he mattered. 2 weeks later, he sent her a message. He'd been hired. He was training staff. He was saving lives. She smiled when she read it. Then her pager buzzed. Mass casualty alert. Multi-vehicle accident. All hands on deck. She grabbed her gear, headed for the door. The work was never finished. The calls never stopped. But she didn't run from them anymore. She ran toward them. Because she was Doc Keller, and this was what she did. She showed up. She didn't quit. And she saved lives. One after another after another. And somewhere in a hospital she'd left behind, in a program she'd built from nothing, in the hands of medics and corpsmen she'd trained, her legacy continued. Not in applause, not in awards, in the quiet beep of a monitor, in the steady rhythm of compressions. In the moment a patient took their first breath after nearly taking their last. That was enough. That had always been enough.